In this video, we will be covering the proper technique for use of various types of prescription inhalers. This training is important because in order to achieve the best outcome for your breathing disorder, proper use of your inhaler is necessary. For all inhalers, standing while using is preferred to sitting. However, sitting is acceptable, and you must ensure you are sitting up straight if you choose to do so. For all breathing disorders, there are two types of inhalers that you may be using. The type of inhaler depends on the medication or medications inside of them. The first of these types are maintenance inhalers. These are used on a scheduled basis. The second type of inhalers are rescue inhalers. These are used for shortness of breath and should be used as needed. Until you are familiar with your inhalers, use a marker to place an M on your maintenance inhalers and an R on your rescue inhalers. Consult with your prescriber or pharmacist to determine if your inhaler is for maintenance or rescue. Using your maintenance inhaler more often than prescribed will not improve any difficulty in breathing and in some cases may cause it to worsen. Even though your rescue inhaler may say 1 to 2 inhalations every 6 hours as needed, you may use it sooner than every 6 hours if you are having difficulty breathing. However, you should report how often you utilize your rescue inhaler to your prescriber. Utilizing your rescue inhaler more often may cause jitteriness or your heart to race. One tool that you can utilize to track the progress of your breathing disorder is a peak flow meter. A peak flow meter measures the forced volume of air that you can produce at that period of time. You can then compare your daily measurements with your personal best. Your peak flow meter measurements can be used to determine if you need to utilize your inhalers to prevent an episode of difficulty breathing. Utilization should be in accordance with your provider's directions and recommendations. For the proper technique, utilize the video on peak flow meters attached below in the description. It is good practice with all inhalers, but especially if the inhaler contains a corticosteroid, to rinse your mouth out with every use. The first inhaler we will be teaching you how to use is your metered dose inhaler. For first time use, or if you have not used your inhaler for more than 2 weeks, you will need to prime the inhaler. To prime the inhaler, first you must remove the cap. Then, shake the inhaler for 5 seconds. Hold the inhaler away from your face and with your index finger, activate the inhaler. Repeat these steps for a total of 2 to 4 times or until drug spray is seen. Your inhaler is now primed. Now we will teach you how to use your inhaler. First, you must check to ensure that your inhaler is not empty. To check this, look at the counter on the back of the inhaler. This tells you how many doses you have left. If your metered dose inhaler does not have a counter, detach the canister from the mouthpiece and place the canister in 2 inches of water. If the canister floats on its side in the water, then it is empty and you need to call the pharmacy for a refill. After ensuring there is medication in the inhaler, remove the cap. Then shake the inhaler for 5 seconds. Exhale deeply. Place the inhaler in your mouth and breathe in using a full, constant breath of 3 to 5 seconds as you push down on the canister. Hold your breath for 5 to 10 seconds, then exhale. Repeat these steps as indicated by your directions for use. We will now teach you how to clean your metered dose inhaler. Most manufacturers recommend cleaning your inhaler on a weekly basis to prevent medication buildup in your inhaler. To wash your inhaler, first remove the medication canister and the cap from the mouthpiece. Run warm to hot water through the top and bottom of the plastic mouthpiece for 30 to 60 seconds. Then, use a soft cloth to remove any buildup of medication from the pinhole in the mouthpiece. Shake any excess water off your mouthpiece and allow to dry completely. If you need to use your inhaler before it is dry, shake any excess water off the mouthpiece, reinsert the canister, and do 2 test sprays of the inhaler away from your face. Now we will be teaching you how to use and clean a spacer. Spacers are used with metered dose inhalers to ensure a full utilization of the spray. A spacer is recommended for everyone, but is necessary if someone has difficulty timing their breath with the inhaler. To use a spacer with the inhaler, you must first ensure the inhaler is ready to use by removing the cap and shaking it for 5 seconds. Then, place the inhaler into the receiving end of the spacer. Remove the mouthpiece cover from the spacer. Activate the inhaler and inhale from the spacer and hold your breath for 5 to 10 seconds before exhaling from your nose. Breathe in and out for a total of 4 times. If the whistle sounds while you're inhaling, you're doing so too fast. You should wash your spacer once a week. To wash your spacer, separate the spacer into its individual parts. Place the spacer parts into warm, mildly soapy water and wash them. Ensure that all soap residue is rinsed off before use. Be sure not to dry the inside of the spacer with any cloth that may leave behind pieces of lint. Allowing your spacer to air dry is preferred. Now we will be teaching you to use a dry powder inhaler. Like all inhalers, there are many types of dry powder inhalers. We will be using the N-Hub dry powder inhaler. Ensure that the inhaler is not empty by checking the counter on the side. The counter indicates the number of doses left. Remove the cap and expose the mouthpiece. Pull down on the lever and expose the medication. Exhale completely but not into the mouthpiece. Place your mouth on the mouthpiece and seal your lips. Breathe in as quickly and deeply as possible. Remove the inhaler from your mouth and hold your breath as long as possible. Breathe out slowly through your nose. When cleaning your dry powder inhaler, do not use soap or water. If your mouthpiece needs cleaning, clean with a dry cloth. Now we will be teaching you how to use the Respimat Soft Mist Inhaler. Before using your inhaler for the first time, you must insert the cartridge. To do this, press the safety catch on the side of the inhaler to remove the plastic base. Push the cartridge into the inhaler until it clicks. To ensure it is completely in, push the cartridge against a tabletop. Once the cartridge is in, push the plastic base back onto the inhaler until you hear a click. Before your first use of the Soft Mist Inhaler, you must also prime the inhaler. To prime the inhaler, hold the inhaler upright with the cap closed and twist the base clockwise until it clicks. Open the cap and point the inhaler away from your face. Push the button on the side of the inhaler until you see a mist come out. Repeat these steps for a total of 4 times. If you do not use your inhaler for more than 3 days, then repeat the priming steps 1 time. If you do not use your inhaler for more than 3 weeks, then repeat the priming steps for a total of 4 times. To use your Soft Mist Inhaler, hold the inhaler upright with the cap closed and twist the base clockwise until it clicks. Then open the cap, breathe out completely and place the mouthpiece onto your mouth while holding the inhaler horizontally. Make sure you are not covering the air vents on the side of the inhaler. Take a slow, deep breath in and press the button on the side of the inhaler. Once you have taken a full breath, hold the breath for 10 seconds. Breathe out. To clean your Soft Mist Inhaler, do not use soap and water. Use a damp cloth and wipe the inside and outside of the mouthpiece. If you have any questions about the proper technique of any inhaler, please give us a call at Pools Pharmacy Care.